Newsroom, and I'm Kelly, your host here tonight. We are live in Portland with some breaking news. There has been an increase in diagnosis of chronic bronchitis over the past few years in Portland. Normally, this would not be as alarming as chronic bronchitis is a very common disease and nothing new. However, there has been a 150% increase in the diagnosis of this said condition, and the CDC has been very vocal about this rise in our city. With the ongoing COVID pandemic, as well as it being flu season, there has been some concerns of how this might affect those who already have chronic bronchitis. For the public out there, we have gathered two nurses from Concordia, Portland to talk to us about chronic bronchitis.
Hi, Kelly. Thank you for having us on. My name is Sydney DeBoard, and I'm a nurse at Concordia. And this is my fellow nurse, Casey.
Hello, everyone, and thank you for having us.
Thank you for being here with us to talk about chronic bronchitis. The general public may not know much about this topic, so I will briefly explain what chronic bronchitis is. For those who do not know, bronchitis is an inflammation of the lungs in which bacteria or a virus is the cause of this said inflammation. This type of inflammation can be triggered by other things as well, such as chemicals or environmental agents and much more. However, chronic bronchitis is mainly due to repeated exposure of the pollutant, such as cigarette smoking or workplace chemicals. So your workplace may have a lot of chemicals you may not be aware of that could actually cause this condition. So please make sure to check with your workplace to see if there is any pollutant that could be affecting your lungs. The pathogen or pollutant is seen to go to the bronchioles and cause inflammation. The inflammation causes an increase in mucus production in the bronchioles, and the airways become obstructed. Gas exchange becomes difficult due to the increase in mucus production. Because of this, common symptoms include a productive cough with sputum is produced, chest pain, reported shortness of breath, difficulty breathing, wheezes, sore throat, nasal discharge, a cold, a fever, headache, or muscle pain. These symptoms can be very scary and often mistaken for pneumonia. It is important to see your provider immediately if you experience any of these symptoms, since the cause of chronic bronchitis are on the rise. Some common questions your provider may ask are, when did this cough start? When did you begin having chest pains? What color is your sputum? And describe your chest pain overall. It is important to understand that chronic bronchitis is very serious and can impact your overall quality of life. Early diagnosis and treatment is key to help with the disease. So for our viewers, can you guys explain how this disease can potentially affect our organ system or if it affects it at all?
Yes, I would love to explain more about chronic bronchitis. So since chronic bronchitis is a pulmonary disease that affects the bronchi and the lungs, its main detrimental direct effects are going to be on the respiratory system. From researchers at Johns Hopkins Medicine, chronic bronchitis can result in a deep, thick sputum cough that often leads to wheezing and severe chest discomfort. As symptoms of chronic bronchitis begin to worsen, the ability to breathe normally to receive sufficient oxygen begins to see a serious decline. As lung function continues to be impaired, the balance of gas exchange in the lungs can have serious consequences on important tissues and organs in the body. From the American Lung Association, when the flow of air in and out of your lungs is decreased by inflamed airways, less oxygen is being delivered to tissues and organs, which makes it significantly more difficult to properly remove carbon dioxide from the lungs. This can also significantly increase the risk of hypoxia, which can affect the neurological and cardiovascular systems, and in many cases can even be fatal. With prolonged chronic low levels of oxygen, the heart is working in overdrive by raising heart rate and contractility, which can result in hypertension. With prolonged hypertension, the risk for heart failure and peripheral edema significantly increases, which can have detrimental effects on the body as a whole. From a review from the European Respiratory Journal discusses the effects of chronic pulmonary diseases in the nervous system. There's a high prevalence of depression in patients suffering from this disease, as it may be a psychological response to the diagnosis. Since this disease is irreversible, it can make the diagnosis much more difficult to cope with. Overall, it is super important that we protect our bodies from such a viral disease, as well as eliminate common risk factors, for example, smoking. It can have a long-lasting detrimental effects on the body, which can be hard to treat, as antibiotics will not be helpful.
Thank you, Sydney, for that information. We see that it really affects more than just our respiratory system, as it can affect our cardiovascular as well, and many people need to be aware of that. Safety of the public should be our number one priority, and as healthcare workers and providers, I'm sure you guys know what to look for when looking at a patient and if they have chronic bronchitis or not, and if they can tell between pneumonia and chronic bronchitis. Can you go more into detail about the head-to-toe assessments you guys do and what you're really looking for and what would be most helpful when caring for a patient with this said disorder?
Yes, thank you. So it is important that a complete history and physical examination is performed in order to diagnose a pulmonary disorder. Before the assessment, we ask questions to get a better idea of what the patient is currently experiencing. We ask about risk factors such as smoking or any allergies that are present. We then discuss the symptom and associated factors such as when they first experienced the symptom, how did the symptom occur, was it quick or did it happen over an extended period of time, and how long the symptom has been present. Since we have seen that coughing and chest pain is both a symptom of chronic bronchitis and other cardiovascular diseases, it is important to ask questions that differentiate what the patient may be experiencing. After discussing the current condition of the patient and gathering the client's vital signs, the next step is to conduct a thorough physical assessment. When performing head-to-toe assessments on individuals who may have chronic bronchitis, we start by observing the breathing pattern of the individual. Is their chest wall rising and falling with symmetry, or is there a sign of the use of accessory muscles when trying to breathe, or even flared nostrils? This may be a sign of increased work of breathing and respiratory distress. We also look for any clubbing in the fingernails, which is another sign of insufficient oxygen, along with testing capillary refill in the fingernails, which should be less than 3 seconds. During this time, we can also count the respiratory rate for 1 minute. A respiratory rate below 12 indicates bradypnea, and a respiratory rate above 20 indicates tachypnea. Next, we start by palpating the skin. We look to see if the skin is warm and without pallor or cyanosis, which would indicate a decreased amount of oxygen and possible infection of the lungs. We then move to the chest to examine symmetrical chest expansion by placing 2 hands on the posterior lateral chest. During this, we look to see if our thumbs move apart asymmetrically while the patient takes a deep breath in. We then move to percussion, which is when we tap tissues to elicit sounds. We perform a certain pattern of percussion on the anterior and posterior chest wall. The changes in tone we hear are based on the density of the tissue. For example, if we hear a dull sound, that can indicate a solid mass or fluid buildup. We then can move to auscultation, where we use our stethoscope to listen for any fluids or solid substances in the lung. Normal breath sounds vary based on the anatomical location of the lungs. Over the trachea, breath sounds should sound very loud and high-pitched. Over the bronchi, there is an intermediate pitch in intensity. Vesicular breath sounds are low-pitched and can sound longer in inspiration than expiration. The abnormal breath sounds include crackles, wheezing, friction rub, and rhonchi, which are low gurgling-like sounds over inflamed bronchial airways. Diagnostic testing such as X-rays and sputum and blood tests are also often used to detect infections and inflammation. When caring for this disorder, it is important to not overexert yourself, causing strenuous need for heavy breathing. It is also important to drink plenty of fluids and work on coughing up any mucus that may be blocking your airways even more. Tools such as an incentive spirometer can be used to improve lung ventilation.
Thank you, Sydney and Casey, for that wonderful information and for the interview. I know it's been really tough seeing more cases of chronic bronchitis on the rise, and I hope our viewers are more informed about chronic bronchitis and what it entails. So for our viewers, please visit government sites such as .org and .gov for more information and talk to your provider if you are experiencing any of these symptoms. So that is it for tonight, folks. This is Portland's Newscast, and we'll see you tomorrow night at 8 p.m. Thank you.
Thank you.
Thank you.